It's a great pleasure for me to welcome you all to the 31st Annual Distinguished Statistician Colloquium, sponsored by Pfizer, ASA, American Statistical Association, and UConn. Today, we honor the distinguished career of Dr. Thomas Lewis. Before we begin, we have some important safety announcement. In the unlikely event of an emergency, please take a moment to locate the nearest exit. Exits are available at the main entrance and to the right of the stage, just behind the podium. For everyone's comfort, please ensure your phone is silenced. This program is being recorded and live streamed. Thank you for the helping us maintain focused and welcoming atmosphere. Now let's move on to our exciting program for this afternoon. Please join me in the welcoming Dr. Harold Offer Harold, Dean of the College of Liberal Arts and Sciences, who will share a few words about the history and legacy of this distinguished colloquium series. Offer? Offer. Thank you.
Good afternoon, everyone. And I need to check if it's morning or evening because I don't always know. So it's fun being here. I'm lucky to say I'm being most of those in the last 20 years, and now I'm coming as a dean, so that's even more fun piece for it. So I was tasked with giving some history lesson. Now that I'm the dean, I'm in charge of the history department. So some history for those in the room. So the Pfizer Colloquium was first established in 1978 through collaboration between Pfizer, the UConn Department of Statistics, and the American Statistical Association. This enduring partnership was originally led by Professor Harry Posten of UConn and Dr. David Salzburg of Pfizer Global Research and Development. Following Professor Posten's passing in 2002 and Dr. Salzburg's retirement, the program's leadership continued under the Professor Nitis Mukapadi of UConn and IT Ting when he was at Ting, and Nitis is here. In 2009, Dr. William Dagen of Pfizer succeeded Dr. Ting in his role, and this long-standing collaboration reflects shared commitments to advancing the field of statistics and honors its pioneers. It also reflects a core value of the College of Liberal Arts and Sciences, connecting academic excellence with real-world impact through strong industry partnership. As a statistician, I'm especially proud that our college hosts this Pfizer Colloquium, a forum where academic and industry leaders can exchange ideas and advance the fields together. Now it's my pleasure to invite Deepak back again and introduce the honoree. Thank you.
It is now my distinct honor to introduce our guest of honor, Dr. Thomas Lewis. Dr. Thomas Lewis is a retired professor from Johns Hopkins University's School of Public Health and Department of Biostatistics. He has also held the department chair position at University of Minnesota Biostat. He received his PhD from Columbia University Department of Statistics in 1972 under Bert Singer. He is the author of many papers, especially on survival analysis, empirical base, and after that more in environmental related or public health. And his famous book is one of our former student, Brad Carlin, is named Bayes and Empirical Bayes Methods for Data Analysis with Brad Carlin. So Tom has multiple experience. He was also in Rand Corporation and other universities, and he was the past president of the International Biometric Society. So without any further comments, I'd just like to invite Tom to start.
Oh, good. So, and I can do escape apparently. I'll let you go from there. Got it. Okay. Well, hello, and first of all, thanks to Deepak and whatever the team was that selected me, to Juliet and her team for the arrangements, to Pfizer, UConn, and the ASA for supporting it, and to others who have come in person or on the web. I have fond memories of interacting with David Salzberg, sometimes, actually maybe half the time sparring, but always interacting. And it is consequently a real honor to have been selected as the 31st of the sequence in this speaking. Mark Twain, who was a nearby resident previously, remarked, and I probably got this approximately, not exactly, that it's far better to not receive an honor and deserve it than it is to receive an honor and not deserve it. I'll say that without comment, and we'll go on to see what's going on here. So what I'm going to do is give a little bit on some of the trade-offs in statistics, where pretty much everything in statistics is a trade-off, so that in fact I could speak approximately forever, but I'm not going to do this. And the title also has this: there's no free lunch, but there are reduced price meals. There are many places where you can give a little and get a lot, or at least give a little and get a little. And I just put up here, here's the kind of maybe somewhat free lunch, or at least reduced price. If you've ever been to a place called Barmini in DC or something else, this is by no means reduced price, but it's actually pretty good. So to speed up not having to talk about everything, I'll do just a few things in a bullet point. We all know that trading off variance and bias is maybe the classic of the trade-offs. By trading a little bit of bias for a reduction in variance, you can improve the mean squared error sometimes dramatically. Certainly CI length and coverage, you get more focus or less focus depending on the coverage probability. Robustness and efficiency, you may have to pay some efficiency if you want to protect against your model not being completely correct. Single versus multiple goals, and I'll get back to that. Certainly Bayes versus frequentist, there are trade-offs there. Again, it's something I can't spend a lot of time talking about, but I highly recommend. I know it's an old reference, it's a goldie oldie to me, that it's probably worth everyone reading this short article in the American Statistician. I like the idea of talking about design-based versus model-assisted, design-based and model-assisted survey or other designs versus model-based and design-consistent. And papers by Rod Little and others are very good at kind of blocking out the territory there. And even though it's not officially about trade-offs, I really find that in many cases we have to be careful about the best of the breed being a dog, meaning that you can have the quote-unquote optimal procedure within a certain set of assumptions and goals that may still be horrible. So 2 examples. An unbiased variance component can be negative. Just tucking it back in to be positive can improve the mean squared error, even though it's no longer, I'll put it another way, heaven forbid it's biased. And one of the ones you may have all seen in your basic classes, Poisson observation with 1 observation, and you want to estimate the probability of no events in the next 2 time periods. The best unbiased estimate, actually the only unbiased estimate, estimates +1 if x is even and -1 if x is odd. I think it's better to go for something that is maybe just a little bit biased, if nothing else. So here are the dimensions of the examples that I'll be covering. And again, each of these at a not terribly detailed level. I'm putting a lot of citations, so if you have the interest, you can look further. And it's clearly a small sample that maybe is a little bit of the principal components, or at least 3 of them, around a pretty complicated space. And so I'll talk a little bit about compromising by departing from a likelihood, compromising by weighting, weighted averages, we've already seen it on the previous slide. Addressing multiple goals to try to maintain pretty good performance for all the goals you care about, but having to give up a little bit if you want to get a broader domain of goal satisfaction. And then one that I may or may not have time to do more than give a brief outline of is the analysis of longitudinal data with all sorts of trade-offs of robustness versus efficiency, protection against missing data, at least in an MIR type missing data process, versus paying by having delicate sensitivity to the model specification. So there's some slides in there. I have it so that I may have to just jump to the conclusion if I've taken too much time. But first, and I actually, the next slide, I mentioned it to Ron at the hotel last night, Wasserstein, and he said, it's a good thing you got this next slide in because you're not allowed to give a talk at UConn without a slide like this. So UConn rules, you have to have something like this in here. And so I feel I'm amongst champions and that we can hope that in 2026, you could have a similar slide for next year and for next conference. Okay, the need for stabilization. I don't think I'm going to be telling people much about the need for that in many cases. If you have small domains, they could be anything from geographic areas to demographic subgroups, whatever it might be. In general, they need a little help. They may be unbiased, and you may even know their variance, their standard error, whatever, or their posterior distribution. But they may be so noisy as to be almost useless. And so it would be a good idea to stabilize, and there are a lot of different ways, and I've only put a few of them down here. Aggregation, just pool, regression itself, and I suppose I have to add AI just because I have to add AI. Bayesian hierarchical model, and I'm putting Bayes in parentheses because it doesn't have to be Bayes. I'm going to try to get this to be more cooperative by being, sorry, out here. And these are all ways of trading off bias and variance. So that's one of the golden oldies of it we all kind of know. So I'll take an example, and I'm trying to keep things not terribly technical, but I do need a little bit of formalism to make some points. So here's a basic model that is at least hierarchical and random effects, or if you want to make it Bayes, you can say that word too. It's got a standard kind of regression structure, but now I'm putting in a weighted average of the data themselves, which let's assume for the moment are unbiased, but may be very noisy, and the model, and I'm taking a weighted average. If you were a standard old-fashioned regression person, you would set B to be 1, and you would just use the regression. If you thought that you needed everything to be unbiased, you would set B to be 0, and you'd say, I'm just going to use the data. And so this is another of these compromises. Another way to look at it is it's the model and then a certain amount of residual going back towards the observed data. And B is something that is supposed to be approximately an optimal weight, which trades off the variability of the individual measurements and what you can think of as the unexplained residual variation. It's basically bias squared for the model. Nothing really new here. And it's easy to see that B will be larger for the relatively unstable estimates because sigma squared is going to be bigger. So it's more weight to the model for those things. But if you use the likelihood-based approach, and I stress that by having the MLE up here, that automatically gives more trust and more weight to the relatively precise estimates. So you have this situation where the domains that care a lot about the model because they need help also have less influence on it. There's no problem with that. If your model is properly specified, you do want to go with the quote-unquote optimal beta, which would be the lowest variance one you can get. But if you ever worry that your model might not be correct, in other words, you should always worry, you might want to think about doing something. And one of the things to do will come up in the next slide, but high spectral profiling is an example of this, only one example. The MLE gives more weight to the large hospitals, or at least the hospitals with large patient load for whatever this condition was. But a misspecified model, meaning that the smaller hospitals aren't getting as much influence in the risk adjustment thing, can really penalize in a financial and reputational way the hospitals. And so you actually do care about not necessarily trusting the model completely. You'll notice instead of just putting Norman et al. And having to plow through the rest of the thing to get the reference, I like putting the full citation whatever I can on things. So what to do? First of all, here's an example of these kind of weighted averages. The top picture is a little confusing. It looks a bit like my hair. These whiskers are the width of actually a credible interval in a Bayesian analysis. Here are the direct estimates, and this is in a malaria prevalence in small areas in Africa. And I'm not giving you, there are hundreds of them. I'm only giving examples of a few. Down here is where you can see the shrinkage action. This line is now the residual of the observed data from the model without any Bayesian adjustment. And this is now shrinkage of those residuals. And you can see in this case, at least, there's enough uncertainty in the individual domains. They're all about population size 70 or 50, some number like that, that they all need a lot of help. And it pretty much says use the regression model. This is actually a nonlinear model, and just as a side note, using MCMC, we've used the zeros trick to produce this, where we pretend everything is Poisson, but just use that to develop a model that's complicated within each of these domains. So one of the discussants, Sunil Rao and his co-collaborators, have come up with something to say, let's have an actual algorithmic, or at least approach to trying to not give as much weight as the MLE would give. And actually give a little more weight or a lot more weight depending to the higher variance ones, because they care about it. If you had a well-specified specific estimate for a domain, you can just use it. It doesn't need any help for these predictions. And I'm giving none of the formulas, but you basically use something to minimize mean squared errors of the saturated model to produce something called the best predictive estimator, which will in general not be the MLE. And you can use bootstraps and other things to support statistical inferences, even though you're not in the likelihood domain. And I won't say that again, but you could say it for everything I'm going to do, is you can use bootstraps and other things to inject the appropriate uncertainties in a model that is not, if you'd like, likelihood or other kind of foundation based. So these are both weighted squares estimates, actually, in that linear model at least. And they have weights that are can be in either somewhat different or very different. This picture is a little bit overstated, and maybe I did it to make the point, or maybe I just got too lazy and didn't want to fix it up a little bit. But here are the weights that are a function of the sample size of an individual domain, and you notice they go up and go up. Whereas the best predictive one, in this case, starts getting a lot more weight. In fact, this is where it's a little deceptive. It's almost like we're going to give all the weight to the ones that have only one observation. I should probably adjust the picture. But the main point is very different from the black dots. Sunil will say, Tom, you should have just done something in here. He's probably right, but I was too lazy to correct it. So another theme of this talk and of my statistical life in many ways is, I'll call it rinse and repeat. So we now have two different ways to do the weighted estimates. They both are using the direct estimate as one weighted thing and a model as another. And we now have the two models being the MLE produced one and in this BPE produced one. So for lack of anything better to do, we thought, let's see what would happen if you repeated the idea of weighted averages. Why don't we just take a weighted average and go back here, to take these weights and do a convex combination of the weights to produce another weighted average. So again, without going through the technicalities, but having you go to this paper, you can find what is the database produce best estimate of alpha, how much weight you should put on, by using something from Stein's unbiased risk estimate. And again, it's an empirical thing where you can compute it in a data set, and it minimizes in a random variable sense that expected MSME. And so the idea is, can you do better than either this or this by giving those two models another chance with a weighted average? And I probably wouldn't be up here talking about this example if it weren't true that you could. So here we go. This is the MLE. Forget about the E-bloop, bloop, bloop stuff. REML is another that's a similar thing. Here's the best predictive of Jiang et al. And Rao. And this last one is this weighted average. So here's a simulation based on the following model. Remember that if you have the properly specified regression model, the MLE is the way to go. So I'm putting things in small font size that don't really need to be worried about here. You have sample sizes, and the main thing to look at is that the thetas, the underlying parameters of the domains that you never get to see, depend on the sample size. So it's like the small hospital example, that in fact, the underlying truth depends upon the size of the hospital, with a correlation of rho for those. You can ignore all of that in terms of today's talk if you'd like. We're going to look at simulations where the model includes the appropriate regression model, but does not include the thing that drives the correlation or drives the thetas themselves. So unless the correlation is zero, the model is incorrectly specified. And therefore, you might expect that taking total dependence on it might not be a good idea. I.e., it's always the case that it's not properly specified. You better be careful. So here are the results of two simulations. This one where the sample sizes are uniform in the log scale, and this where it's just a 2-point, the big ones and the small ones. The black and the green are the MLE based, and you don't have to worry about the distinction between those. The red is this observed best predictor, and the blue is this quote unquote compromise. It's yet another compromise amongst the compromises. And here's a case when rho is zero, the model is correct because we don't need the ends. And not surprising, the likelihood based ones are best. But when you get even a little bit away, there's no free lunch. You're going to pay a little bit either in red or blue when the model would have been correct, but you get a reduced price meal because it doesn't take too long before, in this case, it takes a fair amount of time before you are either close or beat out the parametric model that assumes the model is correct. The 2-point is even a little more dramatic that way. Again, there's no free lunch. If the model is correct, you're going to pay either a bit or a lot by having not used it. But it doesn't take long before you have a win by using the either the red, which is the observed best predictor, or the compromise, which is this blue one. Now you could say, and maybe it should be done, well, we've now taken a weighted average of the data in the model, and then we've now taken a weighted average of the model in the model. Maybe we should do it again. I leave that to others to see how long before there's no progress involved in this thing. Oh, I will say that there are a couple of other slides at the end that give a data example for this. I found that it was a little too hard to talk about them in real time without using up so much time that I would not have time for other things. So there are some slides at the end of this that will be on that I hope will be on the web along with everything else to look at a few other examples. So let's go to multiple goals. You can think about lots of multiple goals, but I'm going to take just a couple of this one specific example. But I'll start by saying there's a paper which I suppose I think is ignored in some sense, or at least not properly paid attention to. It's one that has to do with maximum efficiency robust tests, and Joe Gatsworth's paper. He's got others on it, but it's the idea of I'm doing a regression model or a logistic regression, and I may care about power for alternative 1 and alternative 2, and I'd like to have something that optimally targets alternative one. Here's the approach. Alternative two, here's the approach. What if I want to pay a little bit about each of those, but maximize the minimum efficiency of those two, or of the three, or of the five? So it's kind of a neat paper to look at on multiple goals, very explicitly paying a little bit, but still getting a lot. But I'll take one that is at least something I and others have worked on quite a bit, where you want to estimate the direct estimates things, which is like what we've just done in the previous slides, but you also like to get the histogram of the underlying truths for the domains, whether they be regions or whatever, and you'd like to be able to rank them. Now, the formalism for what I'm going to do on this is definitely Bayes, and part of that is that I think even if you're not a Bayesian, never want to be a Bayesian, hate the B word, whatever it might be, it's actually a very good way to start thinking about problems and to say, if I had the truth in my hands, how would I rank them? How would I make up the histogram and so on? And can I then come up with a procedure where I don't know that stuff, but I can use the data to try to get at that, as opposed to starting with thinking about data, to start thinking about underlying truths. And this is going to be just one example. I will say, by the way, that these procedures I'm making, they're going to be Bayes, but in a lot of cases, if you're in the empirical Bayes domain, which I'll get to in a few minutes, or if you simply put on flat priors and others, you get very good frequentist performance for these, but I will speak in a Bayesian language here. So you want something where ranking your estimates, whatever they are, gives you optimal ranks, and remember the idea that the best of the breed can still be a dog. There are different ways to even talk about optimal, but for any one of them, you'd like the ranks to do a good job, maybe an optimal job. You'd also like that for the histogram. And you certainly don't want to give away your interest on the individual parameters. So it turns out you do have to pay a little bit there. You don't get a completely free lunch, but you can get estimates that are very close to what you would get if all you cared about were the underlying parameter estimates. So here we go with a cast of thousands of papers and authors and so on. And here's the ranking challenge, which is why I think it's important to imagine that you've got the truth in your hands, and how do you rank them? Well, you put the smallest, the next, and the next. One thing you'd like with ranks, or really should require, is that if you take a monotone transform of the underlying truths, like if you take the log of the underlying parameters, you'd like the ranks to stay the same. For any other monotone transform, you'd like it, whatever procedure you use, to not have the ranks depend upon what you did to transform or not transform. And we get to one of the Goldilocks solutions in these problems, that generally posterior ranks do not comply. You don't get this transform constancy. If you rank maximum likelihood estimates, because of the theorem about maximum likelihood estimates and their transform being the maximum likelihood, they do comply with this idea of the ranks not depending on the transform. But they're really suboptimal because they unfairly, well, they unfairly either penalize or reward, depending on which way you think it's good or bad to be, for the high variance ones. They tend to stick out at the edges. If you do ranks based on hypothesis tests, where you say use the p-value, heaven forbid, or something else to decide on the extremes, they have the problem in the other direction. They unfairly penalize the units, or reward, depending on whether you think big is good or big is bad, the ones with the low variance, because they're now the ones that ring the bell, if you'd like. So you need something in the middle ground, kind of a Goldilocks solution. And here's this warning I have in general about optimality and its discontents. You have to be careful to evaluate to see whether even the optimal is acceptable, or whether you need to come up with a different criterion, or at least a heads up that things aren't as great as you might have thought. So I'm going to dock a lot of this to an example from quite a while ago. You can see another of the discussants listed here, because it's very important when you're giving a talk to pander to the discussions ahead of time. I don't know if it'll affect what they're going to do later, but at least it can't, well, maybe it can hurt. I don't know. We'll see. So these are examples using data from the United States renal data system data. And we're going to look at the standardized mortality ratio, which is observed deaths, that's easy, there they are, and expected deaths, which of course, if I were to open that box, depends on a model. I'm not going to talk about that, but obviously the key to whether any of this works well or not, having nothing to do with ranking or anything else, is have you got a good value for the denominators or not? They come from a case mix adjusted analysis, and in this case, we're doing for almost 3,500 providers. The sample sizes range from essentially nothing, I1, all the way up to quite solid. So you'd assume this unit doesn't need much help, and this one needs a lot of help in the model. And so the expected deaths also, not surprisingly, have that same range. And the uncertainties do too. And so here's a picture of the data. These are the 95% confidence intervals. The dots are the point estimates. And so here are the bigger standardized mortality ratios, the smaller standardized mortality ratios. And you can see that the uncertainties are all over the place. And in fact, it would be very hard, or at least I would find it impossible, to try to kind of broker where those dots are in the context of the noise that is very different across the board here as to what the right way to go about ranking is. Because you're not getting to see these underlying truths, you're just getting to see this kind of thing. If you build a Bayesian model and compute the posterior distribution of these SMRs or other things, this picture is only there to say the whole scale of the spread has all of a sudden been reduced. But now if I expand the scale down here, it's the same picture actually, but now you can see this goes to 10, goes to 2. Two things are apparent. One is the variation is very much more stabilized, not completely, so there's still some variation in the variation. You get a set of dots. Again, it's the same data set, but the order of these are different. It's no longer that what I saw in the first picture. This one up here is not necessarily the same one as it used to be. And in fact, here's an example with only a subset of those that shows what's going on. So here are the direct SMR estimates. And these whiskers are the estimated standard error. And I wish I had done Bayesian uncertainty intervals, only because you get now some units that have 0 deaths. So the naive estimate of the uncertainty is 0, and there's a whisker that isn't there. You can see that some of those are more stable than others. These are very unstable and need to shrunk almost all the way back to the middle. Here's one that's somewhat stable. Over here, here's one that's quite stable. So this is an example of some of these need a lot of help, others don't need much help at all. But the main point is the lines cross. The direct estimates order and the, in this case, Bayes posterior order are different. Otherwise, the lines wouldn't cross. So how to broker this? Well, you do need a little formalism to do that. And we hope that with any monotone transform of the SMRs, for example, the log, but it doesn't have to be, that we're going to get the same answer. And here is the line that says, if I had the thetas in my hand, not the data, but the theta, or whatever your favorite letter is, how would I order them? Well, I'd just compute the sum of how often theta k is greater than theta j. Add them up. There'll be, and let's say there are no ties, there'll be integers from 1 to k. We don't have the thetas, and if you want, you can do percents by just doing that. So the smallest theta has rank 1, so on and so forth. And if you were to put in e to the theta and e to the theta, you'd get the same answer because it's just the yes, no, am I greater than or less than. So if I do it in the Bayesian formalism, and again, it works that this same procedure with careful specification of a prior, or in this case, with 3,000 or so units, empirical Bayes will allow you to do this even if you don't want to assume a prior. The squared error loss ranks are simply to take the expectation of this and compute the probability that theta k is greater than theta j given the data. Sum those puppies up. They're now not integers, they're numbers that range between 0 and 1. And the percentiles are again this. If you want integer ranks as opposed to these fractional things, and you may want one or the other, you don't have to want one or the other. You just rank those, and it turns out that that's optimal. These ranks are based on the squared error loss idea, but you could do the same sort of thing by, instead of ranking and taking this expectation, just for each of these units, compute the posterior probability that the underlying parameter is greater than some target value t. It might be a disease incidence that's important to not get above, so on and so forth. So it's not that it has to be this, but this is the sort of core ingredient that gets you to let Goldilocks take her day. So here's a very basic computation, but gives you the idea. Just take the standard Gaussian model where the thetas are Gaussian, the data are Gaussian given the thetas, and see how things go. In this case, if you had no information at all, the squared error loss is 833, which is basically the variance of a uniform distribution. So all of these numbers are relative to that. And if there were no variation in the sigma squares, meaning the precisions of everything are identical, it doesn't matter what you're ranking. They give you the same answer because all of the distributions, they don't cross. I'm leaving this out because it's a middle ground, but if you talk about variation that's high, like in the example we've done with the mortality ratios, the optimal one is a 522. You get to pay a little bit by not being all of the variances being equal, but you can see if you go and use the MLEs to rank, you pay quite a bit. So this is worthwhile to go to this kind of technology. Here's an example from protein expression. And each color is a protein on a malaria array, and you can read down here what these are. This column are the original data. These are after we have done some sanitizing to get rid of artifacts and so on. So at least if you believe we did a good job there, these lines crossing say these are better numbers to use. This column is the squared error loss ranks. And this column is that probability of being greater than t, with the t picked to actually produce about 3% of the population of these things being above the t. And you can see again, I can't tell you which one is better to use, but that there are trade-offs. If you use this exceedance probability one versus the general purpose squared error, the lines cross. And so as a person trying to identify the sort of active genes or the active proteins, you have to decide what criteria. And of course, you can change the 3% to other things. It's an example of where we statisticians can come up with technology, but not relieving collaborators or regulators or anybody else from having to think. It's kind of a horrible thought, but this does not solve the problem. It identifies the problem in many ways. And I think it's a good example, again, because there are enough proteins on this thing, that 21,000 or so, that you don't need to be a Bayesian, you can be an empirical Bayesian and let the data tell you what the prior is. And I'm staying away from that technology because I can't talk about everything, but at least to imagine that this is all, it's empirical based, other than the fact that we of course make assumptions about what the models are. But short of that, it's empirically based. So now, continuing with this idea of getting back almost to the Gatsworth thing of satisfying multiple goals. So we've gotten so far the ranks. We know how to at least have a good job on those. We know how to get a good job on individual estimates, but what about the histogram of estimates? It's going to, unfortunately or fortunately for me, be another Goldilocks issue. But first, a picture that I first saw a long time ago, that if you think about, here's the mean of the data, you generate parameters in a Bayesian model. These are the thetas. From the thetas, you generate the y's. And you ask, what's the Bayesian solution to this in this very optimal, simple case of minimizing squared error loss? Well, squared error loss is always minimized by dropping a perpendicular. So these are the Bayes estimates. They go partway towards the y's, partway towards mu, and here's the weighted average. But if you want the spread to be correct, if you want the histogram to be correct, in the spread sense, you don't do that. You take the theta vector and rotate it up here. And you get, in fact, in this simple case, it's just instead of using 1 minus b on the y's, you take the square root of them. You get bigger weight on the y's. And so this turns out to be, for this simple problem, the right shrinkage, if you'd like, to make the spread of the histogram be correct. Making a formalism out of that, it's the same idea, and I won't belabor it. I'll try to do it. Well, I guess I have time. It's the same idea. If I had those thetas in my hand, what would I do to make up the histogram? Or at least let's start by saying, what would I do to make up the empirical distribution, not the histogram, but the step function? I would do the same sort of thing I did before. I'd sum the integrators of the thetas being greater than, less than or equal to t. And I'd get the usual CDF marching up with t. We don't get to see the thetas, but we do get to see their posterior distribution. And here's the squared error loss version of getting the best histogram, which now just sums up or produces this thing, which is the mixture of the posterior probabilities of thetas being less than or equal to t. And you'll get a histogram out of this. These are the right tail probabilities that I mentioned before, and you can use those to do the histogram too if you want. So this is a continuous histogram. It's not fractional or anything here. If you want the best discrete one, you don't have to worry about the formula here, except you just pick off the quantiles of that distribution to get the k numbers that are, in some sense, the best numbers to histogram for the histogram goal. So here's an example that was motivating me, at least back in '84, probably in '83 or '2, depending, about how to get the spread right. The posterior means are too shrunken. From that picture I showed with the perpendicular drop, it was too shrunken. The MLE is too spread out. Is there something that's just right? Now, what is it? Why is it called GR? It was like compute the CDF and take the ranks, but it's a label we could never get away from, I think. But it's just right. Now, this is a simulation. Obviously, in any given data set, it's not just right, but its estimand is just right. You can look at these papers. And Malloy Ghosh later on did the same thing with a little more fancy mathematics, because he can do that. So if you look at that same thing for skewed distributions, I won't bore you with what all of these are, except they aren't doing a good job of getting a skewed distribution correct. But if you go to this, what if I had the thetas in my hand, blah, 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 blah. Again, the estimand is exactly right. This is an expectation over simulations, but it says you're targeting the right thing. And here's a data example that Susan and Greg Ridgway and I and others had. These are math achievement scores, and I'm going to focus on the right-hand column just because it has a smaller sample size. Here's the histogram that you might make up if you were just making up a histogram. And there's a fair amount of uncertainty in some of these data points, and some of them are exhibiting themselves right here. If you go to this Bayesian approach, assuming that the underlying thetas come from a Gaussian distribution, and do empirical Bayes again, you find that, as with almost any other procedure that is assuming, in this case, a Gaussian a distribution, in this case Gaussian, it's going to try its hardest to make things look Gaussian. It just wants that to be the case. Ditto if you're doing a standard regression and you look at the residuals and you've used a Gaussian model, they try to be Gaussian as much as they can. This bottom row is one using a Dirichlet process prior, if you want to just think of it generally, a non-parametric prior. And you still have a little bit of this dribbling off to the edge, but they get shrunken in a bit, but it is not trying very hard to be Gaussian. And these turn out to be performing very well in estimating underlying histograms. So we now have the idea of, we have at least a version of optimal ranks, and there are several, and we have a version of optimal histograms, and there are several. We do have to give up a little bit on the quote-unquote optimal for the direct estimates of the individual parameters. And so we're going to come up with something called triple goal estimates, with, again, the technology isn't very complicated, but you take these mass points to be the quantiles of this distribution we had for the CDF. So just pick off these numbers and get K of them. And then the triple goal estimates that are going to try to satisfy ranks, histograms, and individual estimates, simply order these U's according to the optimal ranks. So they obviously will have the ranks that you want. They obviously will have the histogram you want because they come from that. And so what about individual estimates? This is not the way you would think about producing the ideal individual estimates. I'm going to give you just this thing for the basic Gaussian model. You could do it for others, but just to say, how much do you pay if you do these other two things, but still want to have pretty good estimates for the individual parameters? The worst case of doing this at all is when you have, for the optimal estimates, the weight on the data to be 0.382. If you look at what that is for the optimal histogram, remember for that basic vanilla Gaussian case, you just take square root of this thing, you get 0.618, more weight on the data. And it just happens to turn out miraculously, and that is the golden ratio. It has nothing to do with this talk, except I found that pretty pleasing because I found this in Weishan, and I found it the day before I went to an exhibit of Vermeer in The Hague, and he has perfect ratios all over the place. And so I thought, well, there might be a God, who knows? But if nothing else, this gives you how much you pay for that ranking goal, excuse me, for the ranking and histogram goal if you still want optimal or somehow good direct estimates. And the payment isn't that much. So you again get reduced price, but not zero cost. Okay, challenges in longitudinal analysis, and how much time more do I have? 5? Perfecto. So I won't do the detailed examples, I'll just do this. Trade-offs, trade-offs, trade-offs. Accounting for correlation in generalized linear models or linear models has the potential certainly of increasing efficiency relative to working independence. But if you look at certain pictures, and I have one down in the slides I'm not showing, generally the efficiency increase isn't that much. It's not zero, but it isn't that much. However, there is no free lunch in the sense that the correct model for the observed data, mean function and covariance model, protects against missing at random missing data process. But it turns out when you build regression models or spatial models with correlations, the dependence on model specification is subtle and challenging and fragile. It may not seem that way until you get to examples, and I'm not doing them right now. And working independence is far more robust to regression misspecification, but of course it's not at all protective of missing at random data processes. So trading off efficiency and robustness to protect for MIR is challenging to kind of strike a good balance with diagnostics and so on, but there is no free lunch. There may be a reduced price one. And this brings me to one of my favorite quotes. It's from Stephen Sen. Mathematicians deal with lemmas and statisticians with dilemmas. I mean, I think it almost says what our field is. We use mathematics, obviously, computer science too, but in real life, statistical life, we're just confronting with dilemmas, maybe even trilemmas, but at least something that isn't theorem proof all the time. Now, I actually did something here where I think I can just skip to the end without having to page through slides. If it doesn't work, I'll just, okay, here we go. So CODA, there are a few slides on the longitudinal in there, and there are some slides below this, if you'd like, that will be on the web for some examples I didn't put on the talk. Trade-offs permeate all of statistics. I'd probably be hard to find something where there isn't one in the sense of real life, so to speak. Efficiency versus robustness, single versus multiple goals, likelihood-based versus likelihood-motivated, which I like, versus ad hoc, and I don't mean that in a derogatory sense. What was it, George Box, don't make a mockery out of informed ad hocery, something like that. Bayes frequentists, there are trade-offs, but it's worth striking them. And then ... is everything else. Fundamental statistical principles still apply and are key. All aspects of design. Space-age techniques will not rescue Stone Age data, I suppose, unless you're studying the Stone Age, and then it might, but other than that, probably not. So statistics in the real world, for me anyway, pure likelihood, pure unbiased, pure Bayes, pure frequentist, pure any statistical principles, it does pair nicely with port uppercase p, especially if you have a good port. But when you leave port lowercase p, for the high C's of application, some degree of impurity is really necessary. Consequently, for me anyway, statisticians who successfully engage in important applications and studies, these are precepts. All of these, whether any of this list here, are precepts as aids to navigation, if I can continue the nautical analogy, but are not straitjackets. The goal is to do a good job. And one shouldn't be too doctrinaire. I don't want to say you shouldn't be doctrinaire, but you shouldn't be too doctrinaire. You're looking at my website under a set of documents called Thoughts While Not Shaving, which I started after I retired. I asked colleagues, what does it mean to you for you to do a good job? And there's a whole list of answers in there. So anyway, I'll simply get out of your way in this part and say thank you. And to show you there are more slides, they're there.
Thank you, Tom. Thank you, Tom.
Get out of your way.
Yeah, actually, now audience is open for any question, a couple of quick questions. Please raise your hand if you have a question, and then one of the students will pass the microphone. Okay, Ron.
Answers are okay too.
Yeah.
So Tom, I'm just going to start with a nonsense question to get things rolling. But you mentioned at the very beginning that you wanted to give the complete list of authors on your papers. And so like in the Norman paper, for example, you listed everybody. And I just want to suggest that in the future, you could save yourself some trouble by just going et al. And Lewis. And that should do the trick.
Well, maybe at al. But I never published for that, so. But thank you.
Any other question, comments?
I'll ask a question.
Yes. Susan.
Well, thank you, Tom, for a terrific talk. And I had a question about that example. I think it's the maybe microarray data, perhaps. Not a bio person, so I think it was the one with Ingo and Henderson. Oh, gene expression. Thank you. See, I'm a social scientist. So.
It's protein expression.
Protein expression. Okay.
Someplace.
Ah, there it is. Yeah, when you were speaking about method A and method B, and just sort of the conundrum of how do you choose, between A and B, and I'm curious if there's anything you could share sort of about those conversations with your colleagues about, that choice, or if you ever had to make a choice, or if it was a matter of, say, looking at this problem several ways and just kind of triangulating to, sort of learn from the data.
Could everybody hear the question? Okay, good. So in this case, for this one, I wouldn't say it's easy, but it's almost easy in that the idea was these protein arrays, if you'd like, nominate the antigens that may be of most interest. And there's a certain cost in every sense to follow them up with other assays. And so the idea here was, how many can we afford to follow up with? Which is not an answer I had, but that they had. So they said, maybe we can afford to look at 60 or something like that. And though we set, I'm not saying it, I can't remember the number, but that set that 3%, and we'll nominate the top posterior probability 3%. And if there were some marginal things that were so close, maybe go a little further. Other situations, it might not be so easy. In some contexts, you may want to go with method A. I'm using the labels that were in that paper to say, I just want to produce some general purpose ranks that you don't have to ask anything about, but you may prefer the other things. And that allows me to answer something I should have said back in the ranks, histogram, and estimates, to say, if you do some other things with them and say, here are my best individual estimates, but don't you dare rank them. And don't you dare compute a histogram of them. And here are my best ranks, but don't use them for anything else. It's not very satisfying. If you can have all three, where some of them are very good and others are pretty good, it's not bad for public policy and other things, and for the reputation of statistics as actually having an answer, so to speak. Does that help? At least.
Okay. Okay. Thank you. And thank you, Tom and Dr. Lewis.
We're especially delighted this year to welcome Dr. Ron Wasserstein, Executive Director of the American Statistical Association, who is here with us in person to share his message of congratulations.
It really is a delight to be able to be here. Usually, unfortunately, I've had to send along video-taped greetings and congratulations, which of course I don't mind doing, but I can't look the recipient right in the eye when I congratulate him that way. So I'm very happy to have that opportunity for my friend and colleague, Tom. So I do bring welcome and congratulations from the Board of Directors of the American Statistical Association. Tom, congratulations on this well-deserved honor and a great career. Tom contributes to many things, and one of them that didn't get mentioned today, he wouldn't have had any cause to mention it, but he's been a big help to me and to the ASA over the years, and especially in recent years with difficult issues related to statistics and policy. And so we're really grateful to have your input on that. But one contribution that you've made, Tom, to the American Statistical Association that you may not realize that you've made, but you wrote, along with Marie Davidian, you wrote the definition of statistics that we use whenever we talk about what statistics is. So in a 2012-2013 time period editorial in Science, Davidian and Lewis wrote that statistics is the science of learning from data and measuring, controlling, and communicating uncertainty. And so that's what the ASA uses when we want to give a short version of what it is, what statistics is. On a personal level, when I think about Tom, I think about his sense of humor, and particularly, he has a dry sense of humor. So those of you who know Tom, his humor is quite delightfully dry, and I will just say that in 2025, life pairs well with dry humor. So I really appreciate that. Congratulations, Tom. Yep.
We are deeply grateful for the continued partnership and support of Dr. Ron Wasserstein and the American Statistical Association. Now it's our distinct honor to present a warm message of congratulations from Dr. Kanan Natarajan, Chief Statistical Officer at Pfizer. For nearly 5 decades, Pfizer's steadfast collaboration has helped sustain this remarkable series.
Good afternoon. I am Kanan Natarajan, Global Head of Data Sciences and Analytics at Pfizer. It is my distinct honor on behalf of Pfizer, one of the proud sponsors of this esteemed award, to congratulate Dr. Thomas Lewis on his receipt of this distinguished recognition. At first, my humble apologies for not being there in person today, as I'm feeling under the weather and have decided to self-quarantine and recuperate. However, I have recorded this message to show our appreciation to you on this important occasion. Today, we recognize your enduring contributions that continue to guide us through complex data landscapes with precision, innovation, and a Bayesian lens that aids navigation in uncertain waters. Your work as a biostatistician has significantly influenced data-driven decisions in drug development and clinical trials, making the process more reliable and efficient. As a passionate drug developer myself, who has benefited greatly from your work, I cannot resist highlighting just a few of the ways you have transformed drug and device development. Beginning with your seminal advancements in sequential allocation in clinical trials, dating back to the 1970s, you pioneered methodologies that optimize trial designs by dynamically assigning treatments according to accumulating data. These approaches have minimized patient exposure to less effective therapies, enhancing both ethical standards and efficiency, principles that remain vital to contemporary drug development, where time, resource, and patient safety are of paramount importance. At the core of your influence is groundbreaking work in Bayesian statistics, a field very close to my heart. Your innovations in modeling and inference have provided a powerful framework that integrates prior knowledge with new clinical data, enabling flexible, efficient trial designs that accelerate access to life-saving therapies. For instance, your 1991 paper in Statistics in Medicine on empirical base in biopharmaceutical research demonstrated how these methods can synthesize evidence across studies, informing regulatory decisions and treatment strategies. This work has direct relevance to drug development, where integrating diverse data sets accelerates the path from discovery to approval, minimizing risk and maximizing therapeutic potential. Your substantial contributions to subgroup analysis have empowered us to identify variations in treatment benefits and risk among different patient populations, thereby advancing the cause of safer and more personalized medicines. Beyond technical expertise, your role as a bridge between academic theory and practical application has been invaluable. Through your consultative leadership in FDA's CDER, stewardship on data and safety data monitoring boards, and active engagement with academic, industry, and regulatory forums, you have consistently ensured the scientific rigor informing decision-making and policy. Notably, your participation in the FDA workshops and other venue underscores your role in shaping policies that foster innovation for unmet medical needs. Your unwavering commitment to training the next generation of biostatisticians, exemplified by thought leadership such as your 2006 call to action in statistics medicine, ensures the lasting impact of your achievements. Personally, I enjoyed reading Lance Waller's 2018 article in Statistical Science, A Conversation with Tom Lewis, offering your insights on several interesting topics. I appreciate your comments on the interplay between statistical theory and applications, especially calling on statisticians to not just be aware of the formula or the required conditions for it to work, but understand the nuances of the procedures and little issues that increase understanding based on practice, and be able to communicate that effectively with non-statistical collaborators by translating statistical issues in a very simplistic manner to enable co-ownership on decisions on analysis and reporting. An idea that I, as a head of data sciences and analytics at Pfizer, continue to emphasize to all the statisticians in our organization, regardless whether we actually take the frequentist or a Bayesian approach. For the students and the new statisticians in the audience, in this conversation with Lance Waller, Tom has two simple, sane advices for you. The first is to enjoy, and the second is to focus early on in your career and then broaden. And for the oldies, or as Lance Waller calls it, senior statisticians, or as Tom called it, the old fogies of the world, Tom's advice is to reinvent ourselves and be appreciative of the current statistical world. Again, great advice from a man who has had significant achievements, making a profound impact to both theoretical and applied statistics. At Pfizer, where rigorous clinical trials are fundamental to our mission of delivering breakthroughs that transform patients' lives, your methodologies are indispensable. Whether designing studies for complex diseases like COVID-19, oncology, or rare disorders, your pioneering work in Bayesian methods and subgroup analysis has enabled us to tailor therapies more effectively, reducing development timelines and improve health outcomes. For example, the development of COVID-19 vaccine in record time was facilitated by the adoption of a Bayesian approach for primary and efficacy analysis in the phase 3 trial, a significant departure from the conventional frequentist methods used elsewhere, which allowed for probabilistic interpretation under uncertainty and yielded results consistent with credible intervals due to the strength of the data. Additionally, the trial's event-driven sequential design, featuring up to 4 interim analyses, reflects the kind of innovation you had championed. Tom, as we confer this award upon you, please know that the statistical community within the pharmaceutical industry deeply values your steadfast commitment to excellence, innovation, and the advancement of patient health. Once again, on behalf of Pfizer, congratulations on this well-earned and distinguished honor. Thank you, and I look forward to seeing you at a different venue. Thank you.
We regret that Dr. Natarajan is not here in person to share them, yet we thank him for showing his commitment to this series with his recorded remarks. We are now ready to begin the interview portion of our program. Joining Dr. Lewis for this special conversation are 2 of his former students and distinguished leaders in the field. Dr. Susan Paddock, Chief Scientist and Executive Vice President of NORC at the University of Chicago, and Dr. Sunil Rao, Professor of Biostatistics and Health Data Science at the University of Minnesota Twin Cities. Please join me in warmly welcoming our esteemed guests to the stage.
Okay, welcome everyone. I guess I'll start. So first, Tom, I wanted to congratulate you on this very well-deserved honor and thank you for all you've done in terms of research contributions and leadership to the field and mentorship for me personally. I've really enjoyed it, and this is a very well-deserved award. So I'll start with maybe a little bit of history. So you've earned a BA in mathematics at Dartmouth and your PhD in mathematical statistics from Columbia. So what initially sparked your interest in statistics, and how did your early academic experiences shape your career trajectory? And to follow up on that a little bit, who were the statisticians and scientists that most influenced you in the early parts of your career?
Wow. Is this on? That's on. It's on, okay. Good question. So what interested me in statistics started when I was a first-year student at Dartmouth. And Dartmouth had gotten, the math department there had gotten the first time-sharing computer from GE. And people like John Kemeny and Tom Kurtz and others were certainly mathematicians, but also very interested in applications. And we got to sit in front of teletype machines with punch tape, writing basic programs, analyzing data, so on and so forth. And obviously I was also taking appropriate, or whatever you want to call it, math courses. But it really was kind of the existence proof that it was okay to not only do statistics, but that it was a respectable field. It wasn't the thing that kind of sold me completely. And then after Dartmouth, I had a year and a half of working at Chubb & Son Incorporated. And it still scares me to think that they said, oh, well, you were at Dartmouth, you not only know how to use BASIC, but you had some courses on this and that. And they put me basically in charge. They had also gotten the GE time-sharing system of developing what is now called merit rating for automobile insurance, which I, of course, knew approximately nothing about, but did some weighted averages and this, that, and the others, and spent not quite 2 years there before moving to Columbia. And that kind of got me to the point where I was interested in statistics, but also interested enough in math that I didn't go to the biostat department, I went to the math stat department, where I have to say it was an excellent education, but not so much on being a statistician, or at least not an applied one. It was pretty much the only numbers you saw were page numbers and subscripts, but I got a good basis of the math stat and never lost interest in the applied. I sort of became the sole occupant of the consulting center, and that had some fun things going with it. So that's probably more than you want, but enough. Early career people that influenced me, it was really many of the people at Dartmouth, Snell, Thompson, I won't go through the whole litany, but they were all fabulous faculty, many of them interested in statistics and computing and whatever else, but it was an enjoyable and educational time. The Chubb & Son thing, I still remember my boss was Warren Cooper, who looked a little bit like one of the villains in a Bond movie, and bald head and this and that and the other, but he was a great statistician and a wonderful photographer actually too. And at Columbia, it was kind of the cast of thousands. I mean, it was Bert Singer, Herb Robbins, Y.S. Chow, and others. I can't name a specific one for that as much as just a context and environment with individual people. Once I got my PhD, or partway through, I started working a day a week, I guess it was, at IBM Watson Lab, Betty Flanger and others, and they were doing applied work, but also had IBM Model 91 simulator and so on, which was water cooled. It needed to be pretty well cooled. So that was a place to play around a little bit, and ended up getting the basis for proving some things on my thesis on adaptive allocation. Going on from there, I'll do a little more, but I'm not sure this completely complies with my conversation with Lance Waller and StatsI, but it's close. I had the really good fortune of getting a postdoc, an NIH postdoc, for the year after my PhD at Imperial College. The negative of that was David Cox was having operations and so on, so he wasn't there that much. But visitors included Brad Carlin, Rupert Miller, Shelley Zaks, many others. And I got 10 years of statistical education in that 1 year, with working groups looking at the bootstrap, with doing this, doing that. It was, I think, the lucky break that really got me feeling like my career should be this combination of methods development motivated by applications and feeding back and forth, and not everything having to help the world, but be nice to occasionally be able to do that too. I'll stop there. I could go on forever, but there are many other people that influenced me, but you don't want to hear everything, I don't think.
Well, likewise, I want to thank the organizers for inviting me to be part of this and to thank you, Tom, for your mentorship of me. And speaking of lucky break, so Tom and I met while Tom was at the RAND Corporation from 2000 to 2002. And I spent actually the first 19 and a half years of my career at RAND. And so I met you at a very fortuitous time. And it was a wonderful experience to be able to work with you on some extensions of the triple goal estimation. And so, it's really an honor to be here today. Building on some of your career motivations in your career and people who have inspired you, I've heard you mention Fred Mosteller several times in our conversations over the years, which reminds me, of course, of official statistics. And you've had a major role in our profession, in our society. You were chief scientist at the Census Bureau, and you've been on numerous advisory panels. And what I wanted to ask you a bit more about that is what motivated you to become active in that field.
Well, thank you, and I'm glad you brought up Fred because, of course, I should have mentioned him in answering the previous question, but I've been talking about him a little bit already, and I thought I'd done that. So I went, after that postdoc, I went in the math department at BU, and in my almost never-ending quest to avoid security at all costs, I got tenure at BU and moved immediately over to biostat at the Harvard School of Public Health as an associate professor, which is untenured there. But not only got to work with Fred and others, but let's focus on Fred, both in terms of the public policy part, but also how you kind of approach your professional life. As we were just talking a little while ago, you'd work with him, he'd edit, and then he'd edit, and then he'd edit. And you would too. And then he'd have comments like, you need to get this back to me, I want this paper published before I'm deceased, things like that. And he'd come up with these rules that at a certain point, if you're working not just with him, but with a group and you've been writing a publication, he'd declare a moment where if you want any more edits of either the paper or let's say edits of the analysis plan, you got to put $5 in a kitty. And it got further along, it would be $10. And then at the end, there would be a party. So it was saying, yes, we need to edit. We need to really craft our prose, but we also have to stop at some point. And he got me interested in public policy, and both in what was called the Faculty Seminar in Health and Medicine at that point, which I started attending and when I was at BU. It was a Thursday night, once a month, dinner, wine, and the important feature is the ventilation had been turned off for environmental reasons in the Kresge building. So about halfway through the meeting, it got hot and stuffy and so on, which I think was a good way to make this not go on forever. And I remember one example, I'm rambling a bit, but it's because it's fun for me, even if it's not for you. I remember one of those Thursday night seminars where, not seminars, working groups, where we were discussing something and I made a comment and Fred said, Tom, you might want to look at, and he gave me the names of two papers. And I was a young assistant professor at that point. And so that next morning, Friday, I actually had time to go look. And we're not talking at that point looking on the web. We're trundling over to a library, whether it be the department or not. And I looked at them, and then it happened to be that there was a seminar that afternoon at Harvard, and I went to it, and he said, so what'd you think of the papers? And I thought, he had no doubt that I should have looked at that before. From 10 p.m. the night before to 1 p.m. the next day. So he got me interested in, he did some mathematical statistical work too, but his major contribution was in public policy and other things. And it got me to learn how to do that, I guess is the way to put it.
So with regards to your talk, you gave a really compelling case for the usefulness of Bayes and empirical, well, not empirical Bayes today, but in general, methodology. And so I'd like to get your sense of what you think the role of these kinds of approaches are going to be going forward as the types of problems that we're tackling are getting more and more complicated, the data structures are getting more and more complicated. So for instance, I'm thinking of something like combining non-probability samples with probability-based samples, and maybe using the non-probability sample to elicit an informative prior, something like that. So what are your general thoughts about Bayes and EB methods and the role that they're going to play in our field?
It's a good question, and in a sense, hard to answer, except to say that in any situation, I feel, where you're combining evidence from data sets of various qualities and various sort of foci, it's helpful. And I don't want to ever make it a claim that just push the Bayes button and everything's okay and everything's fine, but a way to try to formulate how data sets relate. And in some cases, building what I'll call the Rosetta Stone that tries to connect a data set that may be on the lab study about environmental exposure with another study that's doing the atmospheric exposure, and these with different populations, different this and that, to try to do a complicated version of the same thing I did in the example where I said, what if you had the thetas in your hands? To say, if we can kind of write out the Rosetta Stone, the Bayesian formalism can help you pull that all together in a MCMC or other kind of way. The big if is, can you do it? But it's maybe the easiest example of Bayesian's advantage in a complicated problem, where you can think of it not so much as a Bayesian philosophy or religion, but as the Bayesian formalism kind of helping you get it going. I think talking more generally is difficult to make a point without getting to specific applications. And if we then start getting into this would be a question I'm asking I don't have the answer to. What about the Bayesian formulation in machine learning support vector AI? It's kind of easy to talk about Bayesian CART and other such things. That now happens, but going beyond, is there a formal role for Bayes in these more model-free machine learning / AI kinds of things? I think the answer is yes, but it's an area where I'm hoping the 21st century statisticians will lead the charge, because I'm not going to do it. So is that enough or not to start anyway?
So I want to ask you about surveys, following up on the chief scientist at Census theme. You've had several collaborations that involved bridging topics in one domain to another, and in particular, bridging between survey statistics and, say, either epidemiology or adaptive design in the survey sense, and how we operationalize some of our key procedures for going out and collecting data. In particular, in the epidemiology example, causal inference is a focus there, and a lot of times, as you'd mentioned and discussed previously, non-probability samples are the source of data, and you've done work that I think has just been really illuminating in terms of drawing comparisons and contrasts between these different domains. And I'm wondering what your view is on how these topics are being covered in biostatistics and maybe even statistics graduate programs, and what does that training or mean in terms of how statisticians in the future are going to be operating, and what their tool set and knowledge will be when they're approaching the big data challenges of our time, and and also when I think about biostats, I've hired biostatisticians for over 25 years, and biostatisticians are going into a lot of different fields right now. It's not just the traditional clinical trials and in the pharmaceutical and biotech industry where we fully expect biostatisticians to land, but they're landing in tech and other places. And so, I wonder if you had any thoughts on this.
I do, and it's sort of a long set of questions, or comment or components. So I'm not going to try to attempt to answer all of it, but I'll start by saying in my history as my training and everything, there was no discussion of finite population goals or methods. It was, we have a random sample, blah, 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 blah. It was only after a while in my career that I realized that there was this world out there that was challenging and important, which took the finite population thinking, and mostly because they were dealing with finite populations. And this is somewhat answering your question, but I'll come back to things. Leaping forward, I actually think that we in statistics are missing an opportunity, both in basic courses and in advanced courses, to give, if not prominence, at least lots of emphasis to finite population methods. In the basic courses, because I think it's easier for a student or for a person who isn't statistically trained to kind of get the concept of a finite population. It's not this model floating out in the wilderness. It's something that if you could only see it, the thetas are there, so to speak. It's also the basis, as most of you would know, for double robustness and other things. The approaches there, not to simplify them too much, but they really, the basic ones come from model-assisted finite population thinking with propensities, so on and so forth. So I really think we can do a better job of emphasizing finite population stuff. Where it used to, at least for the people trained in math stat, not survey methods, it was sort of considered our second cousin or something like that. And I now think it should be first cousin or maybe even parent. The idea of getting away from a random sample and trying to relate, again, it gets back to this relating of data sets. There's a lot of work, I've done a little bit, and I mean a little, on how to deal with non-probability samples, how to adjust them or dock them, if you'd like, to a probability sample for part of it. And I think that kind of work is, again, finite population thinking along with statistical modeling, so it's model-assisted this and that, are the kind of opportunities that go along with the question you were asking of combining information, and in this case with maybe some wonderfully randomized studies and then some reference population works that may do the adjustments needed to dock those results to some identified reference population. 2 more points and I'll stop. To do that, you need to have the appropriate propensities. And I'll make 2 comments. One is, if the world thinks at all about representative sampling, they think about self-weighting randomized samples. But in fact, a representative sample, all you need to have it be representative is that you have the sampling propensities, the sampling weights. It is then representative. You pay some variance to get the reduced bias, but you get it. That is one comment, that we need to get away from thinking that the only representative samples are the self-weighted. Simply weighted. The call to action, and in many countries it's a little bit easier of a call to action, Denmark, for example, we need to have many more efforts on understanding the propensities that apply to the membership in certain studies, and whether they be randomized trials, follow-up studies, or whatever, to simply be able to do some of these weightings and references to populations we'd like to address. I got the 5-minute warning, I'm stopping.
Okay, so I'd like to get your thoughts on short-term performance versus long-term stability or generalization. So optimizing for immediate performance, you can think of it as agile research, focusing solely on achieving the best performance for a specific evaluation, like in a particular time window, produces models that might end up being brittle in terms of generalizing well for different conditions or the future. Versus prioritizing long-term stability and generalization, building models that are more robust to changes in the data distribution, that perform consistently well, but may not do as well in a particular task.
I'm going to answer kind of the question you've asked, if that's okay, because it's another area of public policy that I find important that I haven't contributed to, but it would be nice to. Take something like vaccine use. If you make a definitive statement now about everybody should have vaccine A, I'm not going to try to name what it is, but it turns out that next cycle of life, whether 6 months or now, the research shows that maybe not everybody should have it. But you did something that was maximizing uptake at this point, but compromising credibility down the line when information accrued or changed. Versus tempering your recommendation, you may still want people to take it, but to try to couch it in enough uncertainty to say, we may change it and our credibility, we don't want to destroy it, but we're going to probably have to pay some uptake by maintaining some credibility. So it's that kind of a trade-off. It may dop into your things, but it's a public policy area that I know it's being worked on, but I think it deserves a lot of attention. Going for everything now versus paying a little more of stability over time for the uptake that might happen today.
And I've heard on a different in a different direction. I've heard you say several times, and I hope I have the phrasing correct more or less, that there are some people who kind of become the institution they're in. They're the long-termers. They're sort of the pillars that keep, the ceiling in place, et cetera, et cetera. And then there are those who, move around, have different professional homes, and impact different organizations in different ways over the career. And I was hoping you would share with us your perspective in terms of your own career in this regard. And, kind of along these lines, have you found yourself seeking opportunities or being offered opportunities or seizing opportunities? And are there any lessons along the way that you'd like to convey for the early career people in the audience?
Well, I'll start by saying c'est moi for the person who did not stay at one institution. And I am a little bit jealous, but not enough maybe to have regretting what I did, for the people that are institutions in an institution. I didn't do it that way. It was all kind of organic. I didn't plan for it, but I think the thing to say to younger people, don't just jump around for the sake of jumping around, but it's perfectly okay and acceptable and probably good to move for various purposes. And what I've found by doing it, although I have not therefore been an institution in an institution, I hope I've been a little bit of an institution in my profession. And I've learned a lot by each of those jumping around. You have to kind of reinvent yourself a bit for each of those contexts, which is draining and somewhat nervous-making. But I think it's allowed me to have a broader view about statistics, both in the technical sense and its impact on science and society. So I would never say do it on purpose. And I would never say do it without a lot of thought. But if personal situations require it, whether it be family or otherwise, or you've just said, I'm going to give up being an institution in an institution because there's this opportunity, do it. And I'm not an example of the institution in the institution case.
Okay, I'm going to switch gears a little bit here. So you've dedicated a substantial amount of effort to advancing the field through leadership roles, such as your presidency with the International Biometric Society, your advisory work in national organizations. So how has this extensive service shaped your perspective on the responsibilities of statisticians in fostering collaboration and trust in data-driven decision-making? And what's the one piece of advice you'd offer to early career statisticians looking to contribute meaningfully to the field's growth and public impact?
Well, I guess if I had one piece of advice, it's to, I'm going to do this quickly, to make sure that although your role is the statistician, that it's not just technical, and that what you need to do is recruit your collaborators into, they have equal responsibility for statistical thinking. They don't have to be theorem-proof people or anything. They don't even have to understand the formula for a t-test. But they have equal, maybe even greater responsibility for statistical thinking and for the statistical goals. And I'll end, even though I could go on for a long time, with something that the Dean of the School of Education at BU, Bob Dentler, long deceased, but he had this wonderful story. He used to teach at Dartmouth, actually was there when I was there. I didn't know him. And he said, Hanover, New Hampshire, a small town, was very attractive in many ways, but you could never get out of your faculty role, even your disciplinary role. If you went to a dinner party, the only people who were allowed to reminisce were historians. And we have to make sure that the only people who are allowed to do statistical thinking are statisticians. In fact, it has to be far from that.
Well, I know that was the last question, and I do want to say congratulations, Tom.
Thank everybody. Thanks to everybody.
Thank you, thank you, Dr. Lewis, for sharing such meaningful reflections. Before we conclude, we'd love to take one or two brief questions from the audience. Please come to a microphone or raise your hand if you have questions.
Hi, Tom. Joe Capillari, Pfizer. Tom, what would you say is what are you most...
My children. Let's see. What am I most proud of? Is that what you asked?
Yes.
It's a hard question to answer, but probably just the more general, hopefully positive in general impact I've had on statistics, the field, and on not only educating the next generation of statisticians, but to a degree at least educating collaborators that aren't statisticians. One more thing, because it's the other component, I've really had a lot of satisfaction out of serving professional societies as editors and so on, and society more general on panels and advisory groups. So it's that multifaceted thing. There's not one item.
Okay, I have one question to Tom. Yes, my question is, today's students who are doing PhD in statistics, they have to learn a lot of stuff. Like they have to learn good mathematical statistics, good applied statistics, good computing. So what's your advice actually to the students, how they can orient themselves, and in particular moving towards the interdisciplinary area in particular case?
Well, I think it is challenging, more challenging than it used to be. I feel at least my generation had a somewhat easier ride in all of those senses. I think it's the only advice I can give, not the only advice, but maybe the main one I would give is, if you have passion for the field, whatever field, in this case statistics or biostatistics or whatever, you're going to make it through. And I've always said, and I believe it, that I certainly want people working with me, whether collaborators or students or whatever, that are smart, but I'll trade off a little bit of the IQ points for a lot of passion. Those are the real finishers, the right people. So yes, it's a challenging field, especially with all the things you need to do in these days. You still need to kind of wait and strategize about how much time to give to this and to that, and think of it all as you're learning stuff that's going to be useful to you, even if it's useful by saying, I don't want to touch that again with a 10-foot ball, but it's all useful.
Thank you. Any other quick question or comments?
So my question is pretty simple, because you have made tremendous impact, contribution to like public policies, and then public policy is about making impact on general public. And then I feel like a lot of general like people like who are not statisticians or like maybe not very aware of the role that statisticians play, right? And then like people generally know what engineers do, what mathematicians do, and then but they may not really appreciate what statisticians do. Like, what are your advice on how can we increase of our impact on the general public as statisticians?
It's a good question, a good issue. I think the thing to do is to be a professional that realize that your responsibility is both the narrow statistical part and the broader, as it is for collaborators and policymakers, not collaborators necessarily, but the consumers of this, to realize that we all have these responsibilities. And the thing that I would counsel people against, and I'll take AI as the example, although a few years ago I could take data science as the example, and a few years ago from that, no whining. Don't have the Rodney Dangerfield thing of I don't get no respect. Just get out there and do good work, and don't be shy, promote it, but don't be too egotistical, but have an ego for not only yourself, but the field, and do good work, communicate it well. This is an easy thing to say, I know. And consider yourself right from the start a co-equal investigator or whatever the context might be. And I'll quickly say for people I've had as my advisees and others that are looking for jobs, it's the same kind of thing. I say, yes, you're going to go to a job interview, and obviously they are evaluating you. But you need to balance the books psychologically and otherwise to say, I'm also evaluating them. And if you get that kind of mentality, it's not quite like darkness at noon, lights shining on you, as opposed to having them on you, and then you get to shine them on them. And why am I saying that? Because I think it's the same idea. We need to take responsibility for the field and ourselves and project positivity in that sense. These are easy to say. There's nothing easy about doing it. So.
Okay, so if there is no other question, let's give thank you to Tom and Sunil and Susan. And now I request my colleague, Dr. Yao Zheng, to the podium.
Thank you, Dr. Paddock and Dr. Rao, for leading such a thoughtful and inspiring dialogue. And it's now my pleasure to invite Dr. Thomas Lewis back to the podium for the presentation of the award. Dr. Lewis, please, would you please come forward? And I'd also now like to recognize the members of organizing committee who are here with us today, Dr. Day, Dr. Schifano, Dr. Barr. Please join us at the podium. On behalf of our sponsors and guests, Dr. Lewis, we thank you for your inspiring remarks and your enduring contributions to the field. And it's our honor to present you with the plaque of recognition excuse me, in appreciation of your lasting impact on the discipline of statistics.
Okay, good. Okay. Oh, all right. Hold it up. Grip and drink.
You want to say?
Me or everyone? Okay. And I'm done.
Should we get the panelists?
Yeah.
And the whole panel. Yeah. Big bunch of things.
Do I need this for that?
Yes, yes,
Yeah.
yes, yes, you have to hold it.
Okay, yeah, hold it.
Yes,
Won't drop it.
Since Ron is here.
Where's Ron? You gotta get one with Ron.
Yes.
Something's missing.
Yes.
Thank you to Dr. Lewis and our speakers. And thank you to our sponsors, Pfizer, AISA, and UConn for making this event possible. And thank you all for coming. And finally, I'd like to thank our event organizer, Juliet, and our department secretary, Tracy, and all the wonderful student volunteers for making this wonderful event happening. And thank you so much. And we hope to see you again next year. Thank you.